No. Try.
You should explain.
Explain. Explain. Vaastra అది explain.
Explain Manada, Vasta.
Physical disabilities. A physical disability is a limitation on a person's physical functioning and mobility. Physical disabilities include impairment, which limit other factors, other facts like daily living. Amputation, cerebral palsy, dwarfism, uh, spina bifida, arthritis, clubfoot, hand muscular dystrophy, spinal cord injuries. Intellectual disabilities. Intellectual disabilities involve impairment in general meta abilities that impact adaptive functioning in three domains or areas, including com- conceptual, social, and practical. These domains determine how well an individual copes with everyday tasks. Intellectual disability have multiple causes, including biological, physiological, or a combination. Development or inherited conditions include Down syndrome, third one, 81, third one, blue color. Cognitive disabilities. Neurologist disorder which create hindrance in storing, processing, and producing information is called cognitive disabilities. Cognitive disability affects ability to read, compute, speak, and write. Affective disorders. Affective disorders, also known as mood disorders or psychiatric disorders, including depression, bipolar disorder, and anxiety disorder. Symptoms of these disorders may vary from individual to individual and can range from mild to severe. Individuals with those disorders may require help from a physician or other trained mental health professionals. Treatment would include both medication and physiotherapy. To involve students with affective disorder in individual sports like trekking, swimming, badminton, squash, cycling, tennis, and drafting, starting from non-competitive format will be beneficial. A trained APE teacher or a trained coach may use different ways to occupy the students gainfully to enhance their confidence and self-esteem. These services provided by an APE teacher including adapt planning services, prescription placement, the IEP, evaluation of services, advocacy, assessment for individual, teaching, counseling, coaching, coordination of resource and consulting.
So, some more topic we will discuss, and in this topic, the lesson is actually Paralympic and all that. Okay, and here when you are studying for your exam, 11th standard children, you will have to know following things. Okay, one is categories of disabilities and explain them, then types of physical impairment, and then you can go through some physical disabilities and intellectual disabilities which was read just now. So about physical impairment, now the topic will be covered by your peer group. Just a minute. So now about physical impairment.
Yeah, rotate
Again
blade.
rotate like this. Camera எங்க இருக்கு?
Oh, this one. Physical impairment. There are 8 different types of physical impairment. Impaired muscle power. With impairment in this category, the force generated by muscles such as muscle of one limb, one side of the body, or lower half of the body is reduced. Example: spinal cord injury, spinal polio symptoms. Impaired passive range of movement. Range of movement in one or more joints is reduced in systematic way. Acute conditions such as orthosis are not included in this category. Loss of limb or limb deficiency. A total or partial absence of bone or joints from partial or total loss due to dysmelia. Leg length difference. Significant bone shortening occurs in one leg due to congenital deficiency or trauma. Short stature. Standing height is reduced due to shortened legs, arms, and trunks, which are due to mus, mus, musculoskeletal defect or bone or cartilage structures. Example are achondroplasia, growth hormone deficiency, orthogenesis imperfecta. Hy- hyperto- Hypotonia. Hypotonia is marked as one abnormal increase in muscle tension and reduced ability of a muscle to stretch. Hypotonia is result from injury, disease, or condition which involve damage to the central nervous system. Example: cerebral palsy. Ataxia. Ataxia is an impairment that consists of lack of coordination of muscle movement. Example: cerebral palsy, Frederick ataxia, multiple sclerosis. Orthotosis. Orthotosis is generally categorized by unbalanced involuntary movement and difficult maintaining a sym- symmetrical posture. Examples: cerebral palsy, coro- corollaterosis. Visual impairment. Athletes with athletes with visual impairment ranging from partial vision sufficient to be judged legally blind to total blindness. This includes impairment of one or more components of this visual system: eye structure, receptors, optical nerve pathway, and visual cortex. The cited guidance for athletes with a visual impairment are such a close and essential part of a competition that the athletes with visual impairment and the guide are considered a team. Along with cited goalkeepers in five-a-side football, became eligible to receive medals of the own. Intellectual disability. Athletes with significant impairment in intellectual functioning and assorted limitation in adaptive behavior falls under the category of intellectual disability. The IPC primarily serves athletes with physical disability, but the intellectual disability group has been added to some Paralympics games. This includes only athletes with exceptional athletic ability who have intellectual disability diagnosed before the age of 18. However, the IOC recognized Special Olympics World Games are now open to all people with intellectual disability.
All of you, and after this, another topic we will be covering. Okay, so